So, what if our entire healthcare system was designed to keep you healthy instead of just fixing you when you get sick? That's the huge idea at the heart of Malaysia's ambitious health white paper. And today, we're going to break down its vision for a healthier nation.
This is really the core question, isn't it? For a long time, our system has been incredible at being a fix-it shop for when things go wrong. But this new vision is asking a different question. What if we could prevent things from breaking in the first place? It's a massive shift in thinking, from just reacting to being proactive. And this slide really lays it all out. On one side, you have sick care. It's totally reactive, it only kicks in after you're already sick, and its whole world revolves around hospitals, treatments, and cures. But on the other side, you've got healthcare. This is all about being proactive. It's focused on the community, on your lifestyle, on preventing illness from ever starting. We're talking about a move from being an engine of repair to becoming an entire ecosystem of wellness.
And here's the perfect way to picture it. For so long, we've been really focused on parking that ambulance at the bottom of the cliff, ready to react with expensive treatments after someone has already fallen. The new vision is about building a fence at the top. It's about creating an environment that stops people from falling into poor health to begin with.
So, how do we actually build that fence? Well, the first strategy is all about creating a much smarter and stronger public health system. And this is way more than just posters and campaigns. We're talking about using data and foresight to protect the nation's health before threats even show up.
It really boils down to 3 steps. First, you have to collect way more data from all over, clinics, research, even from the community itself. Second, you analyze that data with some seriously powerful tools like AI and GIS, which is basically super smart mapping, to spot trends and predict health risks in specific areas. And third, you act on it. You intervene early with things like targeted screening programs to stop problems before they get big.
Of course, for all that data to work, you need a solid foundation. The plan calls for some big structural upgrades. We're talking about a new National Center for Disease Control to lead the charge. It also means getting much better at public communication to fight all the misinformation out there, giving real support to community health volunteers, and actually enforcing the rules that are meant to keep us safe.
But here's the thing. Even the smartest public health system can't do this alone. And that brings us to the second strategy, which recognizes a really profound truth. Health isn't made in a doctor's office, it's shaped by the world we live in every single day. This is about moving the whole conversation out of the hospital and into our communities.
The key idea here is something called social determinants of health, or SDH. It sounds a bit academic, but it's actually pretty simple. It just refers to all the non-medical stuff that affects our health. Our income, our education, the air we breathe, the safety of our neighborhoods, all of it.
And you might be wondering, okay, so how much does that stuff really matter? Well, the impact is absolutely staggering. Research shows that up to 80% of your health is determined by these social and environmental factors. The actual clinical care you get in a hospital, that only accounts for about 20%. That one statistic completely changes where we need to focus our energy.
So what does this actually look like in real life? I mean, think about it for a second. Does your neighborhood have safe parks where you can exercise? Are healthy food options actually affordable and easy to get? Is your job stable? All these things have a massive, direct impact on your well-being, day in and day out. So if all this stuff outside the hospital is so important, how do you even begin to tackle it? The strategy is called Health in All Policies, and it's a pretty brilliant idea. It means that the people in charge of things like transport, housing, and education have to start thinking about the health impact of their decisions. Suddenly, health isn't just the health ministry's job anymore. It becomes a shared goal for the entire government.
Okay, so if health is now everyone's business, how do you get everyone, on board? That brings us to our third strategy, which is all about behavioral science. The big idea here is to design a system where making the healthy choice is also the easy choice.
And this is really the classic carrot and stick approach. The carrot is all about incentives, things like financial rewards for being active, or subsidies to help people afford health screenings. The stick, on the other hand, is about disincentives, like taxes on sugary drinks and tobacco. The goal is to use both to gently nudge the whole of society toward better health.
And this really makes you think. When you combine all these nudges on a massive scale, making unhealthy stuff a little harder to get while rewarding healthy actions, could it fundamentally change a country's health for the better? The white paper argues that this is an absolutely crucial piece of building that fence at the top of the cliff.
All right, we've covered the big high-level strategies, but let's bring this all the way down to you, personally. What does this whole shift from sick care to health care actually mean for your life? Because at the end of the day, this isn't just about policy. It's about you and your well-being.
I want you to just picture a future where your doctor's visit is less about getting a prescription and more about getting a personalized plan to keep you well. A future where your neighborhood has clean parks, where healthy food is easy to find, and your own health data can proactively warn you of risks. This is a future where the entire system is designed to support your health, not just react to your sickness.
And that brings us to the final and most important question. This entire vision is about a fundamental change, moving away from seeing health as just a personal problem. Instead, it reframes it as a shared responsibility, for us as individuals, for our communities, and for our government. Is this collective, proactive approach the real future of our well-being? That's the question this whole plan leaves us with.